2026 Mental Health Electroconvulsive Therapy Practice Review. Question 1. A patient with schizophrenia is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Option A. Encourage the patient to ignore the voices. Option B. Provide a structured and safe environment. Option C. Engage the patient in a debate about the reality of the voices. Option D. Ask the patient to describe the content of the hallucinations. The correct answer is option D. Ask the patient to describe the content of the hallucinations. The most appropriate nursing intervention when a patient with schizophrenia is experiencing auditory hallucinations is to ask the patient to describe the content of the hallucinations. This intervention helps assess. Question 2. A patient with major depressive disorder is started on a tricyclic antidepressant, TCA. Which common side effect should the nurse educate the patient about? Option A. Hypertension. Option B. Diarrhea. Option C. Dry mouth. Option D. Weight loss. The correct answer is option C. Dry mouth. The correct answer is C. Dry mouth. Dry mouth is a common side effect associated with tricyclic antidepressants TAS. TAS block acetylcholine receptors, leading to anticholinergic effects, such as dry mouth. Question 3. A client is diagnosed with somatic symptom disorder. Which question will help the nurse develop nursing diagnoses for this client's plan of care? Option A. Are you satisfied with your appearance? Option B. Do you take medication for anxiety as prescribed? Option C. When did you last feel detached from your environment? Option D. How long have you had these memory problems? The correct answer is option B. Do you take medication for anxiety as prescribed? In clients with somatic symptom disorder, it is crucial to assess their adherence to medication for anxiety as prescribed. This question helps the nurse understand the client's treatment compliance, which can impact. Question 4. Which of the following is a common side effect of selective serotonin reuptake inhibitors, SSRIs? Option A. Hypotension. Option B. Sexual dysfunction. Option C. Increased appetite. Option D. Tachycardia. The correct answer is option B. Sexual dysfunction. Corrected rationale. Sexual dysfunction is a commonly reported side effect of selective serotonin reuptake inhibitors, SSRIs. SSRIs can affect sexual function by causing issues such as decreased libido, delayed. Question 5. Maggie, a child in protective custody, is found to have an imaginary friend, Polly. Her foster family shares this information with the nurse. The nurse teaches the family members about children who have suffered trauma and knows her teaching was effective when the foster mother states. Option A. I understand that imaginary friends are abnormal. Option B. I understand that imaginary friends are a maladaptive behavior. Option C. I understand that imaginary friends are a coping mechanism. Option D. I understand that we should tell the child that imaginary friends are unacceptable. The correct answer is option C. I understand that imaginary friends are a coping mechanism. Imaginary friends can serve as a coping mechanism for children, especially those who have experienced trauma. They can provide comfort and a sense of control in challenging situations. Acknowledging and supporting. Question 6. A patient with post-traumatic stress disorder, PTSD, is prescribed prazosin. The nurse understands that this medication is used to treat which symptom of PTSD? Option A. Flashbacks. Option B. Nightmares. Option C. Hypervigilance. Option D. Depression. The correct answer is option B. Nightmares. Prazosin is a medication often prescribed to manage nightmares in patients with PTSD. It works by blocking the action of adrenaline on specific receptors, which helps in reducing the intensity and frequency of. Question 7. Which characteristic in an adolescent female is sometimes associated with the prodromal phase of schizophrenia? Option A. Constantly afraid another student will steal her belongings. Option B. An unusual interest in numbers and specific topics. Option C. Demonstrates no interest in athletics or organized sports. Option D. Appears more comfortable among males. The correct answer is option B. An unusual interest in numbers and specific topics. During the prodromal phase of schizophrenia, individuals may exhibit subtle changes in behavior or interests. An unusual interest in numbers and specific topics may be a sign of cognitive disturbances that can. Question 8. For a patient with obsessive-compulsive disorder, OCD, who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A. Exposure and response prevention. Option B. Dialectical behavior therapy. Option C. Family therapy. Option D. Interpersonal therapy. The correct answer is option A. Exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 9. Which medication is typically prescribed for the treatment of attention deficit/hyperactivity disorder (ADHD)? Option A. Haloperidol. Option B. sertraline. Option C. Methylphenidate. Option D. clozapine. The correct answer is option C. Methylphenidate. Methylphenidate is a central nervous system stimulant often prescribed to manage symptoms of ADHD. It works by increasing the activity of certain neurotransmitters in the brain, helping to improve focus, attention. Question 10. In managing a patient with anorexia nervosa, which initial treatment goal is most important? Option A. Addressing distorted body image. Option B. Restoring nutritional status. Option C. Resolving family conflicts. Option D. Increasing social interactions. The correct answer is option B. Restoring nutritional status. The most crucial initial treatment goal for anorexia nervosa is restoring nutritional status. This is essential to prevent life-threatening complications associated with severe malnutrition, such as organ damage and. Question 11. A female patient diagnosed with schizophrenia has been prescribed a first-generation antipsychotic medication. What information should the nurse provide to the patient regarding her signs and symptoms? Option A. Her memory problems will likely decrease. Option B. Depressive episodes should be less severe. Option C. She will probably enjoy social interactions more. Option D. She should experience a reduction in hallucinations. The correct answer is option D. She should experience a reduction in hallucinations. First-generation antipsychotic medications are effective in reducing hallucinations in patients with schizophrenia. These medications primarily target positive symptoms such as hallucinations and delusions. Question 12. How do epidemiological studies contribute to improvements in care for individuals with mental disorders? Option A. Providing information about effective nursing techniques. Option B. Identifying risk factors that contribute to the development of a disorder. Option C. Identifying individuals in the general population who will develop a specific disorder. Option D. Identifying which individuals will respond favorably to a specific treatment. The correct answer is option B. Identifying risk factors that contribute to the development of a disorder. Epidemiological studies play a crucial role in identifying risk factors associated with the development of mental disorders. By pinpointing these risk factors, healthcare providers can implement preventive measures. Question 13. A nurse is reviewing prescriptions for a patient with major depression at the county clinic. Since the patient has a mild intellectual disability, the nurse would question which classification of antidepressant drugs. Option A. Selective serotonin reuptake inhibitors. Option B. Monoamine oxidase inhibitors. Option C. Serotonin and norepinephrine reuptake inhibitors. Option D. All of the above. The correct answer is option B. Monoamine oxidase inhibitors. Monoamine oxidase inhibitors are less suitable for patients with intellectual disabilities due to the need for dietary restrictions and close monitoring. These restrictions can be challenging for patients with mild. Question 14. Adolescents often display fluctuations in mood along with undeveloped emotional regulation and poor tolerance for frustration. Emotional and behavioral control usually increases over the course of adolescence due to Option A. Limited executive function. Option B. Cerebellum maturation. Option C. Cerebral stasis and hormonal changes. Option D. A slight reduction in brain volume. The correct answer is option B. Cerebellum maturation. Adolescence is marked by significant neurodevelopmental changes that influence emotional regulation and behavioral control. The correct answer, B. Cerebellum maturation, is supported by research showing that the Question 15. Tatiana has been hospitalized for an acute manic episode. On admission, the nurse suspects lithium toxicity. What assessment findings would indicate the nurse's suspicion as correct? Option A. Shortness of breath, gastrointestinal distress, chronic cough. Option B. Ataxia, severe hypotension, large volume of dilute urine. Option C. Gastrointestinal distress, thirst, nystagmus. Option D. Electroencephalographic changes, chest pain, dizziness. The correct answer is option B. Ataxia, severe hypotension, large volume of dilute urine. The correct answer is B. Ataxia, severe hypotension, and a large volume of dilute urine are classic signs of lithium toxicity. Ataxia refers to a lack of muscle coordination. Severe hypotension indicates dangerously. Question 16. In addition to anti-anxiety agents, which classification of drugs is commonly prescribed to treat anxiety and anxiety disorders? Option A, antipsychotics. Option B, mood stabilizers. Option C, antidepressants. Option D, cholinesterase inhibitors. The correct answer is option C, antidepressants. Antidepressants, especially selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs, are frequently used in the treatment of anxiety disorders. These medications help. Question 17. Which statement made by a patient prescribed bupropion, Wellbutrin, demonstrates that the medication education the patient received was effective? Option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Option B. I'm happy to hear that I won't need to worry too much about weight gain. Option C. It's okay to take Wellbutrin since I haven't had a seizure in 6 months. Option D. I need to be careful about driving since the medication could make me drowsy. The correct answer is option A. I hope Wellbutrin will help my depression and also help me to finally quit smoking. Choice A is the correct answer because it shows that the patient understands the dual benefits of bupropion Wellbutrin in treating depression and aiding in smoking cessation. Bupropion is commonly prescribed for. Question 18. Tomasz is a 21-year-old male with a recent diagnosis of schizophrenia. Tomasz's nurse recognizes that self-medicating with excessive alcohol is common in this disease and can co-occur along with option A, generally good health despite the mental illness. Option B, an aversion to drinking fluids. Option C, anxiety and depression. Option D, the ability to express his needs. The correct answer is option C, anxiety and depression. Individuals with schizophrenia often turn to excessive alcohol consumption as a way to manage symptoms of anxiety and depression. This maladaptive coping mechanism can exacerbate the challenges associated with. Question 19. When assessing a patient with major depressive disorder, which symptom would most likely be observed? Option A, euphoria. Option B, anhedonia. Option C, increased energy. Option D, racing thoughts. The correct answer is option B, anhedonia. Anhedonia, the inability to feel pleasure in activities that were once enjoyable, is a hallmark symptom of major depressive disorder. Patients with major depressive disorder often experience a pervasive feeling of. Question 20. Which factors tend to increase the difficulty of diagnosing young children who demonstrate behaviors associated with mental illness? Select one that does not apply. Option A, limited language skills. Option B, level of cognitive development. Option C, level of emotional development. Option D, parental denial that a problem exists. The correct answer is option D, parental denial that a problem exists. Diagnosing mental illness in young children can be complex due to their limited language skills, cognitive development, and emotional development. However, parental denial does not directly affect the child's. Question 21. During an admission assessment and interview, which channels of information communication should the nurse be monitoring? Select one that doesn't apply. Option A, auditory. Option B, visual. Option C, written. Option D, tactile. The correct answer is option C, written. During an admission assessment and interview, the nurse must actively engage with and monitor multiple communication channels to gather comprehensive patient information. The correct answer is C, written, as it. Question 22. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition? Select one that doesn't apply. Option A, alcohol use disorder. Option B, major depressive disorder. Option C, stomach cancer. Option D, polydipsia. The correct answer is option C, stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 23. The healthcare provider is providing medication education to a patient who has been prescribed lithium to stabilize mood. Which early signs and symptoms of toxicity should the healthcare provider stress to the patient? Select one that does not apply. Option A, increased attentiveness. Option B, getting up at night to urinate. Option C, improved vision. Option D, an upset stomach for no apparent reason. The correct answer is option C, improved vision. Lithium is a mood stabilizer commonly used for bipolar disorder, but it has a narrow therapeutic index, making early recognition of toxicity crucial. The correct answer is C, improved vision, because this is never. Question 24. What is the most appropriate intervention for a patient experiencing a panic attack? Option A. Encourage deep, slow breathing. Option B. Encourage the patient to talk about their feelings. Option C. Leave the patient alone to calm down. Option D. Engage the patient in a physical activity. The correct answer is option A. Encourage deep, slow breathing. Encouraging deep, slow breathing is the most appropriate intervention for a patient experiencing a panic attack. This technique can help the patient regulate their breathing, reduce hyperventilation, and promote. Question 25. A patient with obsessive-compulsive disorder, OCD, is performing a ritualistic handwashing routine. What is the nurse's best initial response? Option A. Interrupt the ritual to help the patient gain control. Option B. Allow the ritual but set limits on the duration. Option C. Ignore the behavior to avoid reinforcing it. Option D. Encourage the patient to stop the ritual and discuss their feelings. The correct answer is option B. Allow the ritual but set limits on the duration. In managing a patient with OCD engaging in ritualistic behaviors like handwashing, the nurse's best initial response is to allow the ritual but set limits on the duration. This approach helps in managing the behavior.